3, 2, 1, 0.
Hello everyone, we are from group 11. In this video, we'll explain on of the disease. Okay, come on, watch the video. Did you know chest pain? Chest pain is a condition when the chest area feels aches or pains, whether it's dull to sharp pain or like a puncture. This pain can occur in the right, left, or middle chest. Chest pain should not be ignored as it can be a symptom of a heart attack. Chest pain may last a short time or occur for days. You must be wondering what are the causes, symptoms, treatment, and how to prevent chest pain. So watch the explanation in this video until it's finished.
Okay, after we know what the meaning of the chest pain, so I will continue recapping what is the cause of the chest pain. So chest pain is caused many several problems. The first is the problem in the muscles and bone. It's called fibromyalgia and costochondritis. The fibromyalgia is an acute condition that causes chronic pain in the muscles around the chest that occur continuously for a long time. Also, costochondritis is inflammation of the cartilage that connect the ribs and breastbone, causing pain in the middle area of the chest.
There's a lot of chest pain in this world. One of them is heart disease. And then there's a lot of type heart disease like heart attack, angina, pericarditis, and aortic dissection. Like heart attack. Heart attack occur due to blockage, blood flow, or clot in the blood vessel, such as due to atherosclerosis or coronary heart disease. This disease is because the blockage is usually due to a buildup of fat, cholesterol, and other substances. So there's a block that made of fat or cholesterol, and the process of plaque buildup is called atherosclerosis. And then there's is angina or chest pain or pressure. It is caused by poor blood flow to the heart. This condition can occur because plaque builds up on the inner walls of the arteries and weakness them. This disease is same with heart attack, but angina is chest pain. It's chest pain. So there's pericarditis that it's a swelling and irritation of the thin sac surrounding the heart that called pericardium. So chest pain will get worse when breathing or laying down or do exercising. And then there's aortic dissection. It's a life-threatening condition that involves tearing of the main artery in the heart aorta, which can cause the aorta to rupture.
Another case of chest pain is indication. An example for indication is the one gastroesophageal reflux disease, or people say GERD. GERD is stomach acid in the stomach recess to the esophagus, causing a burning sensation in the chest or heartburn. And the second one is dysesophagia, or difficulty swallowing, a disorder of the esophagus that causes difficulty swallowing food and chest pain. And the last is gallbladder problem or pancreas. Gallstone or inflammation of the pancreas can cause stomach pain that spread to the chest.
I will discuss about lungs disorders. Its function is disturbed. The body's health will also be affected by the disorder. One of the lungs disorder is the ones is a pulmonary embolism. Pulmonary embolism is a blood clot lodged in the lung artery and a blood flow to the lungs causing pain. The next is a collapse deflating lungs or pneumothorax. Is a medical term used to describe the condition of collapse or deflating lung, or pneumothorax or collapse deflating lungs occurs when air enters the space between the lungs and the pleural lining that covers the organ. This can occur due to injury to the chest wall or rupture of the lung tissue, resulting in the lung collapsing due to change in air pressure in the lungs. The next is a pleuritis. Pleuritis is inflammation of the membrane lining the pleures, or a specific is a pleura, which can cause chest pain when coughing or inhaling. The next is pulmonary hypertension. Pulmonary hypertension is a high blood pressure in the pulmonary arteries, namely the arteries responsible for carrying blood to the lungs. Now we will move on to the order of chest pain. The fifth is other health condition. There are two causes, namely panic attack and herpes zoster are sinless. Panic attack is someone who experiences excessive anxiety or fear will feel chest pain followed by rapid breathing, nausea, and dizziness. Herpes zoster or shingles is a disease caused by the reactivation of the chickenpox virus in the body. This disease causes chest pain if there are skin blisters in that area. That is 5 causes of chest pain. Next.
Symptoms experienced during chest pain. First, breathlessness. Second, the body releases a lot of cold sweat. Third, head feels dizzy and body becomes weak. Fourth, recurring chest pain. Fifth, stomach feel nauseous. Sixth, may be accompanied by vomiting. Seventh, sore taste in the mouth. Next, swallowed food returning to the mouth. Next, difficulty swallowing food. Next and last is chest pain gets worse when changing body position, breathing, or coughing.
So in here, I would like to present it about diagnosis of chest pain. So in chest pain, there are so many tests that must be done because there are many causes of chest pain that can causes chest pain. So I would like to tell about some tests that can diagnose of the chest pain. So how we do diagnosis about the chest pain? So the first is there is electrocardiogram or EKG that can record the electrical activity of the heart organ. And the next is there are chest X-ray that can examine the organs in the chest cavity, including the heart, lungs, and surrounding blood vessels. The next is there is a CT scan test that can detect the presence or absence of blood clots in the lungs, pulmonary embolism, or tearing of the aortic dissection. And the next is there are blood tests measure of the levels of the certain enzymes in the bloodstream, which can be a sign of heart damage. And next is there is echocardiogram test that can record about moving image of the heart with the sound waves. And the last is about the angiogram test that can help us look for blockage in certain arteries. So that's all about the, the test about how to diagnose of the chest pain.
Of chest pain is divided into two: taking medicine and operating production. Take medicines are paracetamol, nitroglycerin, thrombolytic drugs, stomach acid drugs, blood thinning drugs, warfarin, and antidepressant. Operating producers are angioplasty, if the chest pain is caused by a blocked heart artery, and to a heart bypass surgery to keep blood flowing without passing through blocked arteries, and three, repair of aortic dissection to repair the tear in the ruptured artery, for reinflation of the lungs if the pain is caused by a collapsed lung. In several cases, surgical procedures like angioplasty or coronary artery bypass grafting may be necessary to address cardiac issues.
Chest pain prevention. Next. Number one, lose excess weight or maintain a healthy weight. And then consume healthy and nutritionally balanced food. And avoid consuming fatty, oil, or too spicy food. And exercise regularly, at least 30 minutes every day. And stop smoking and limit consumption of alcoholic beverage, and have regular health checks, especially if you have hypertension, high cholesterol, and diabetes. Next. Okay, I hope that we have present can be useful for all of us. Thank you. Bye.